And I am live. Hey guys, I am live today with the fabulous. Let me do my pinned comment. The Aesthetics Doctor. Have I spelled that right? Oh my goodness me, I can't spell a thing today. Hi everyone, I'm so excited to be going live and doing a chatter with the incredible The Aesthetics Doctor in just a moment. Bear with me while we sort out the chatter. Have I done this right? Yes, we have. Yay! Let me just get everything on board to go and we'll be live together in a couple of minutes. I can't wait. Oh, I see. We're here. Yay. Now let me do my comment at the top. Give me one momentum. Here we go. Let's pin that to the top. Hey everyone, are you all doing okay? Give me one moment to pin the comment. How is everyone? I'll have a couple of minutes to let people get alerted that we're going live. Sometimes it does and sometimes it doesn't. But then we will invite the incredible aesthetics doctor today, who is an amazing medical practitioner in the aesthetics medicine world. And we've been chatting for a little while now, and we're going to talk about all things aesthetic medicine and beauty. I can't even wait. So we all set up to go. We're not going to lose the camera. Let's put that securely in. Is the light on? Let's be a perfectionist. Okay. So we've got one more minute to go and then I'll invite the incredible doctor in. I'm so excited today. It's been on my list of things I'm most looking forward to. How is everyone? Are you all doing okay? I've been so busy myself today. It's been like a crazy, just one of those days sorting out the admin stuff where you need to like just focus on all the sort of like mathematics and so. Perfect. Now it's time. Okay, I'll stop my waffling. In we go. Done it. Let's have a look. Now I might have to add accept. Let's see if this now works. Hi everyone. Hello.
How are you?
I'm doing so well. Can you see and hear me clearly?
I can. Can you see and hear me?
Yes, I can. How has your day been?
It's been a really good day, actually. I've done a bunch of different things. I was in clinic this morning and then trying to sort out my house because we just moved to London quite recently. So there's a lot of bits and bobs to do. But you know what? Overall, brilliant day.
Oh, thank you so much for joining me
Hi,
today.
guys.
We're going to be talking through...
I can see everyone joining.
Yes. Oh my goodness. I'm so excited to be chatting today about all things that you do. I've been doing this series for a while now and you've been on my list to talk about all these incredible stuff. So yes, let's dive into it. So where did your story of beauty begin? Like when did you want to be in this beauty world, even through the medicine route?
My journey started almost 15 years ago now. So I was born and raised in Tripoli, Libya, and then I moved to St. Andrews. So I was the youngest medical student there. I started at just the age of 16, which is crazy in retrospect now, actually. I kind of knew that medicine was always going to be the path for me. Oh, hello. I could just see people saying hi. So I did my BSc in sciences because I mean, I'm a nerd at heart. I loved kind of core medical knowledge. So I did a science degree to start with, and then I did my medical degree after at Manchester. And throughout that, I did placements in plastic surgery and dermatology, and in so many different kind of specialties that tied into the aesthetics world. And then I did a medical leadership masters and medical education, and that really opened me up to the idea of how is a business run and how does the NHS run and how is a GP surgery run, to just not get the medical side of it but also get the real world aspect of how things actually happen. And then I did my GP training because ultimately I didn't just want to be another aesthetic practitioner that just does a day course or 2 day course and that's it. I wanted to do a little bit more. So I finished the GP training, which took many years,
Yes.
actually. People think GP training is just like that. 4 years later, I emerged and I finished that. So it's been a very long journey. And along the way, I started my first clinic, which was in London. We're Mayfair, just by Bond Street. And then started another one, which is in Cheshire. And then started the third one, which is in Leeds. because actually I love the North so much and I have so many amazing patients up North that I see regularly.
Oh my goodness. What kind of year did you start? Because I remember when I began to explore aesthetic medicine, and it was around
Yeah,
2012, because I started to get through like the grapevine, little bits of information about what the celebrities were doing to tweak themselves, but this wasn't common knowledge.
no.
And one of the things that I really was interested in is trying to like even the playing field when it came to beauty. And I thought with me, when I started my series investigating a lot of these procedures, things like non-surgical rhinoplasty was completely
Mhm.
unknown. There wasn't even that much knowledge about the types of things you could do. Everyone used to use Botox in every circumstance. Like she's got Botox in her lips, which obviously we know is so inaccurate.
Yeah.
But it was almost the time after collagen lips. So what kind of era did you start with? Because this is like amazing.
Probably started doing aesthetics properly about 2016, 2017. That was the kind of time I started, but I kind of dabbled in plastics before, and I actually found that to achieve a lot of results with plastic surgery particularly, it can take so long to reach the, time wise and complications and downtime to reach the results. So actually when I was looking for alternatives, this whole new world of aesthetics that at the time was a bit of a mystery really, because we don't get taught about it at all in medical school. So I had no clue what it was all about. And I actually started in the aesthetics world as a patient because I was really bothered by my under eyes. And I remember
Oh.
going to a practitioner to get my under eyes treated with some derma fillers, and the results were instant. And I absolutely loved it, and it really helped with my confidence, and I just felt good about myself. I remember thinking, I think I can do that. I was like, wait.
Oh, the
And
under
then the rest is
eyes are a
history.
game changer.
Exactly. And then the rest is history. I mean, actually, I ran into that practitioner a few days ago. We were having dinner together, and I was like, "Do you remember almost 10 years ago when you did my under eyes? You changed my world. You actually introduced me to a whole new specialty that, gave me a career now."
Oh, that time period, it was so kind of like I think important when it comes to understanding like the changes of knowledge around aesthetic medicine
Hmm.
because social media started to become more mainstream. And I think like if you look regionally around the world and we saw things like in South Korea, what was going on 10 years ago, 15 years ago, we wouldn't have imagined it in the
No.
West. Like so many different countries around the world were doing their own type of surgeries, especially in the Middle East. There was lots of rhinoplastic specialism that's come from the Middle East. And
Hmm.
like I think social media has made the world smaller, and through that process, we've had to learn all these incredible treatments. So it's been amazing for me to see how things have gone like so far and wide. But do you think social media has got some downsides when it comes to advertising these treatments? Because so many people, especially in the
Hmm.
UK, go to Turkey for these cheaper
Yeah.
options, or they're seeing extreme augmentations with filler. I mean, how do you think that plays out?
I think social media is a double-edged sword, really. I think there's some real amazing positive things, and unfortunately, there's some real downsides to it. So I think thinking of, let's start with the positive, as
Yes.
always. It allows people to connect, similar to me and you right now. Being able to connect to people from all over the world is incredible. And for someone like me, I mean, social media gave me a platform to reach millions of people. Some months, we can reach up to 20 million people across the world, which is actually an insane amount of people if you think about it. I mean, I remember first month we reached 1 million people on social media. That is almost the size of my city back home in Libya. And I was like, wait, how could a whole city have seen my social media? And actually posting, things about how do you select your practitioner, what treatments is suitable for you, how do you actually know if you're suitable for a treatment, how to deal with complications, and educating patients. I'm putting all this free content essentially out there for people to actually enjoy and digest. Very much opened the door for a lot of people to be very informed. And actually, these days, patients come in more informed than ever before, which is absolutely amazing because actually it means that my job is a little bit easier. I don't need to kind of go through every single point because they would have already watched a few videos and got a bit more informed. On the flip side, people can connect to some real dodgy individuals online, unfortunately. And I think, particularly with, let's say, with the aesthetics world, any person could do half a day course and think that they're an aesthetic practitioner without any medical training, or sometimes without insurance, without anything like that. And unfortunately, patients are not aware that how little it takes for someone to reach that title.
Mm.
So people go and get treatments done and unfortunately end up dealing with a lot of consequences and a lot of complications after. And I think this is why I've always been such an advocate for more regulations in the aesthetics world, because actually from the developed world, the UK has actually got the least regulations from any other country.
Yeah, exactly. And there's been such an access to the medicine, well, not necessarily the medicines, but the fillers and the
Yeah.
products used in like aesthetic medicine from the internet in the UK that's not restricted in the same way it is in other places, which I've always been amazed by. But I think it's so incredible because I think the thing that I love about your social media is you're so open and honest, and things are not sensationalized in an extreme way. I mean, people get a lot of clicks when you see on the explore page of social media this before and after that's drastic, but you do things in a gentle, a sincere and an educational way, as you said, which I think has got so many people connected with your audience, which is incredible, and why you've won all these awards.
I try. I think I always really maintain my GP hat on. I think whenever I approach seeing a patient, I very much think about it as a GP consultation. Actually, a lot of my patients always mention how long my consultations are, because I very much go through presenting history. Why are they getting the treatment? What's the real reason behind it? Past medical history, medication, allergies, all the different components of a real thorough history. And then I assess the patient, and then we together reach a management plan. So most of my patients don't come in with a pre-booked appointment. They
Mm.
just book a consultation and we go through it together. Because actually, you might not be suitable for a treatment that you think you want at that moment. And this is why it's really important to go through things thoroughly. Because regardless of how much research you do online, when you come in, I've probably done this a little bit more than a patient. So actually, it's really important to have that dialogue to explain why they might be suitable and why they might not be suitable for a specific treatment.
Absolutely. And I remember when we was chatting last time about
Mhm.
the acrylics. I had a treatment called
Yeah.
acrylics, which is a fat disarming treatment. And the way I had it done, you were telling me that there was a difference in how you could do it with a needle or a cannula, which is more of
Hmm.
a blunter needle.
Yeah.
And I started to notice more puffiness after the treatment than I actually had before the treatment, which was quite concerning. So when you were giving me the insight about what could have happened, I guess we can pop in the clinic and you can have a little look in person maybe. But it was so, I was so grateful when you were explaining it to me, because often when you go to doctors that are doing this as a business,
Mhm.
they're just trying to sell you the treatment. You don't get that honesty back. And I think that's the thing that's key in this sort of climate.
Mhm.
You've got to be solely transparent about all these incredible treatments and what can go
Yeah.
wrong. So if someone was coming for their first aesthetic treatment, say they were a young person that wanted to get their lips done, how would you assess them and say to them, this is what you should think about before you go ahead?
I always kind of start with what do they know about the well, why are they getting it there in the first place? And there's a model in the GP world called ICE, which is ideas, concerns, and expectations. And this is something I always utilize really to understand why is my patient there. So what's their idea of beauty or the results that they want? What's their expectation and what's their main concern? Once you've answered those three questions, it kind of allows you to filter through the patients that are getting things done for the right reasons and the ones that are maybe it's just doing it because it's a trend or they're maybe pressurized. Because actually, unfortunately, it still happens where people come in because, oh, my mom told me my nose looks a bit funny. My auntie said that, my auntie said actually my jawline is a little bit wonky. Oh, and all these kind of situations, which unfortunately it's basically family peer pressure.
Mm.
So that's why I make sure that those patients are the ones that we have a chat and I send them on their merry way. I actually turn away about 15 to 20% of patients. So once we've kind of gone through the bits that kind of I wasn't too sure about, we go through what can we achieve with what they have. Because I will never give a patient results of lips or whatever other area that they didn't have in the first place. I basically try and kind of go along the borders of their own lips, the same kind of shape that they have, just maybe a little bit bigger. The exception to that is if people have had burns or kind of cleft lip or things like that. That's when we really go in and kind of tweak things a little bit further. But I generally try and keep things as natural as possible. We then discuss actually product selection. I think product selection is key. I always go for the softest product possible because our lips are nice and soft, and that gives you just a bit of hydration without too much projection because you don't want that duck lip. And the reality is, when you get lips done properly, they just look so natural. And the majority of my patients say things like, well, my partner of 20 years didn't even notice. Because actually, it just looked good. It just looked natural. It just looked like me on a good hydrated day, the day that I had like 8 glasses of water.
Well, that's something that's also very important, isn't it, with the fillers? Because if you don't hydrate, some of them can really attract water to them, some of them do not. And it's like that can really affect you. You have to have a knowledge of all of that too.
Exactly. And this is what, particularly for areas, soft areas like around the eyes, when people have got kind of puffy under eyes, the patient that kind of wakes up in the morning, you know what, doctor, I'm always a bit swollen in the morning. Well, they're not going to be a good candidate for filler in the under eyes, for example, because actually, if you're already attracting water and you're adding a substance, i.e., filler, that attracts water, you end up with just more puffiness. And that's obviously not the look that we want at all.
Yes. Yes, you have to have like the experience to tell someone exactly what they need. And sometimes it's funny you were saying about peer pressure, because often when I go and experiment with my journalism stuff, when I go to work with all you incredible doctors, my mum sees me the next time, she's like, "What have you done? What have you done
Who
now?"
are
She's
you?
the opposite. She thinks that I'm a crazy guinea pig. But I think it's really important to be honest about some of these treatments, because things can go wrong.
Yeah.
But luckily, when you've got someone that has got the medical training, they can correct those issues by dissolving fillers
Mhm.
and so on and so forth. So how would that process work? If someone got their filler treatment done and maybe it wasn't placed in the correct area, or it could be occlusive to a vein or something,
Yeah,
there's horror stories.
absolutely.
What would the process be to fix that?
So, it depends really. If it's just a cosmetic thing, that's very different if it blocked the blood vessel. So if you start with the latter, so that's actually a medical emergency. And the reason for that, I was like, so that's actually
Yeah,
quite serious.
yes.
And the reason for that is that if you think about it, that blood vessel had a destination. It was going to go somewhere. So what we've done there is you block that blood flow and the oxygen and the nutrients and all that to the destination. That could be the eye, that could be the skin, that could be anywhere else. So you're depriving it from oxygen and nutrients. Therefore, that part of the body is essentially going to start dying.
Mm.
And that's why people can go blind from some of these treatments. So that is quite a serious thing. And the immediate action, if you suspect that, is actually dissolving the treatment. So the dissolver comes in powder form, and you basically dilute it depending on how urgent it is. So if it's urgent, you dilute it in a very concentrated way. So when you inject it back in, it dissolves everything immediately. Whereas if it's a cosmetic kind of reason, i.e., someone just doesn't like their results, which thankfully over the years I've never had to do it for my own patients. But I see, unfortunately, a lot of other doctors and a lot of other practitioners' results that need to be dissolved. You basically dilute that dissolver in a weaker concentration and you just inject it where the filler is, and that naturally just eats it away. I kind of describe it like Pac-Man. It just eats away at the filler and then it just comes out of your system.
Oh, amazing. So there are things that can be fixed.
Yeah.
So are there treatments that are being advertised at the moment that you would consider to be unsafe? Because I mean, I've seen in the last like 2 years or so, a lot of non-medically trained practitioners offer things like for weight loss injections,
Mhm.
which are huge at the moment, especially on TikTok, the semaglutide and Ozempic,
Huge.
or things like hyaluronic acid fillers in the breast
Mm.
area, which I think can also be quite dangerous. Are there things that you would think about looking out for and saying, actually, no, let's not do that?
Yeah, I mean, loads, honestly, loads of treatment. I think I was like, the list can go on and on. I think number one is this lemon bottle fat dissolver, which is a new type of dissolver. Obviously, Aqualex has been around for a long time. This is the new version on the market. Unfortunately, it's coming from Asia, quite unregulated. There isn't an ingredients list on it. So I've been seeing some real horror stories from patients, and unfortunately, me and a lot of my colleagues are unable to fix the damage that is being done by unregulated injectors because we don't really know what's inside the product itself because
I
they've
see.
not released an official ingredients list. So it's a bit of a grey area, really.
And what would
Number
the
two is,
what would the problems be with that
yeah,
one?
yeah, so number one, a lot of people are developing real significant swelling with that. Number two is actually dissolving so much that it dissolves your own salivary glands. So, for example, someone with a double chin, you inject in and it dissolves your own salivary glands. So, actually, you end up with permanent dry mouth.
Wow.
Yeah.
Okay.
Going deeper, it can affect some of the nerves because actually along our jawline, a lot of nerves and blood vessels go there. It can affect that. And I actually saw a patient with a permanent droop in the corner of her mouth. I had to send her to the plastic surgery team to see whether they need to do some nerve conduction studies, some nerve grafts. It's a really complicated situation. And because obviously I didn't know what's in that product, they don't know what's in the product. It's a bit of a guessing game. So
Wow.
patients really are struggling with that one.
Mm.
Yeah, absolutely. So I think the other thing I'm seeing loads of at the moment is these kind of body derma filler
Right.
procedures. So in the breasts, in the bum, and variety of different areas. Unfortunately, I just don't think it's really okay to inject derma fillers in the body. I think things like collagen stimulators, like Lenluma, are great. But filler per se, because the quantity that you need is so much,
Hmm.
that it just affects the natural anatomy and shape. For example, with the breasts, it sometimes can affect the way that actual breast tissue looks and feels and functions because people forget that breast tissue is meant to function during pregnancy and breastfeeding and so on. So when you're injecting all these derma fillers, it can actually affect the glands and the ducts, so it can affect milk production and it can cause other complications in the area. Plus, with the body, I've seen people get injected so much filler. It affects mobility, it affects the blood supply, it affects the shape, it affects kind of when people are being intimate. It can cause a lot of problems there.
That's what I was concerned about when I was seeing so much of this advertised, because there is this sort of like, oh look, and the fabulous afters,
Yeah.
but you're not looking at what's going under the tissue. You don't know how it's going to affect you in the long term.
Hmm.
Like that's what was my major concern when everyone was talking about getting the lip fillers about 5, 6 years ago now.
Hmm.
And I thought like everyone was getting the lips done so drastically that they forget that
Yeah.
the lips are mobile and that filler can maneuver around your face.
Exactly. And I mean, this is why whenever a part of my consultation is I actually always ask my patient to count to 10. And I had a patient today and I was like, do you want to just count to 10? I just wanted to see how things move. Because as humans, we're not 2D, we're 3D. You want to see how tissues actually mobilize and how do you smile and how do you talk. Because essentially, if you're not injecting right products in the right area, things will look quite lumpy and it will just
Mhm.
not look right.
Right, right. Now, there is a question that I think a lot of people get confused about skin boosters and hyaluronic acid fillers. So,
Yeah.
what's the difference between the two and how can they work? Because you can use skin boosters on the hands and things in a way you
And the
probably
face.
couldn't use filler.
Mhm. Yeah, so I mean, I use both very much in conjunction with each other. So think
Okay.
of the filler as the scaffolding for your face. It's actually really deep and it's injected in a way that it's meant to kind of plump areas, restructure, lift, tighten, that sort of look, essentially. Whereas the skin booster is a cherry on top. It's injected really superficially and it's usually a cocktail of vitamins, minerals, hyaluronic acid, amino acids. It's things that just basically works on brightening things. So one is deep, i.e., derma fillers or collagen stimulators, and one is superficial, like skin boosters. For example, things like um, Redensity One or Profilo or those sort of treatments.
Oh, okay. Well, that makes sense because I've never really done the skin boosters. I've always been offered them, but I've always been like, I don't know what they do because I'm a
Yeah,
skincare obsessive. So they just get the
you have
skincare in the
amazing
skin.
skin.
Thank you, thank you. I'm covered in the polyfiller today for the camera, but we're good.
I love that.
So you've got clinics in Leeds, Manchester, and London.
Yes.
And do you find that there's a difference between what people want in the south versus the north? Because sometimes the aesthetic looks and what's trending is
Mhm.
different.
Absolutely. I think starting with Leeds. So I find Leeds quite a unique area because actually there's not a lot of big clinics and a lot of not a lot of kind of well-known doctors that do treatments there. So patients are quite selective with where they go because they've probably done a lot of research to find me. When they come in, it's all about subtle, natural. No one wants to know what they've had done.
Mm,
It's very much, coming from kind of smaller villages and kind of more towns, so they want to
mm.
just look natural. Whereas when you get to bigger cities, I think sometimes people want to look a certain way and they want people to know that they've had treatments because that's a
Yes.
display of wealth. I think back in the day, people could, wear the latest handbag or the latest jewelry or whatever it is. But actually, people sometimes want to be like, oh, no, no, clearly she's had some work done because, you can see that, and that shows disposable income. So from my side, I always make sure with my patients, keeping things very natural and actually saying, rather than doing, 2, 3, 4, 5 mils, whatever it is that we need, let's split that. Let's do it over 2 sessions or 3 sessions, just to kind of maintain that natural anatomy. And whenever I think the patient doesn't need anymore, I'm that doctor that's like, listen, I think we've had enough.
Yes, yes. That's what you need sometimes. You need the objective voice to say, okay, we're here, we're good. You
Yeah,
don't need
we're
that.
we're good. Let's reassess. Let's.
Oh. So when people are starting to look into anti-aging treatments, they're thinking about like, okay, I'm going to be preventative instead of getting things when it may be too late or it may involve different treatments. What age would you think is the appropriate age for someone? I guess it's case by
Yeah.
case, but when would you start advising things like Botox or correcting fine lines?
Yeah, I think when it comes to fine lines and wrinkles and so on, everyone has got lines. Even a baby, when they move, they've got lines. And those are dynamic lines. However, as time goes on, those lines will go from dynamic, i.e., only when you move, to static, i.e., even when you're not moving at rest, you can see those fine lines. Generally, when that transition happens, is a good time to think about preventative treatments. That
Mm.
could be Botox, that could be skin boosters, that could be a laser of some sort, whatever works for you, because everyone is so unique. So generally that happens between the ages of 25 and 27,
Mhm.
because at the age of 25, that's when your body stops reducing collagen production. So you lose about 1 to 1.5 of your collagen production per year from that onwards. So generally by the age of say 50, you've lost about 50% of your collagen production at that stage.
Wow, okay. And collagen is the scaffolding of the skin that's in every part of the body, right?
Yeah, it's the most abundant protein in our bodies everywhere, and anywhere really. Talking about collagen particularly, I'm sure you've heard about all these creams that claim that they can increase
Yes.
collagen, all these procedures that, collagen this, collagen that. Collagen is actually not just one thing. There are so many different types of collagen. The collagen that we want is a type 1 collagen. That's the soft, youthful, fluffy, young collagen. Whereas, say, type 4, type 5, that's actually a scar type of collagen. So that's more
Mhm.
of hard, not really mobile, not the one that you want. So whenever you think about collagen, we always think of type 1 collagen. Not many treatments actually make you produce that because it's very difficult to do so. One of the only ones that we offer at the clinic at the moment is called Elance. It's
Okay.
a collagen stimulator that I get from France, and you essentially inject it similar to a derma filler, but it makes your skin produce 8 times more collagen, and the results can last for up to 2 years. It's absolutely beautiful. It's great for the face, the neck, the décolleté, and the hands.
Would that be comparable to sculpture?
It's very similar actually to sculpture, but I find it's a little bit better because
Okay.
sculpture is quite liquid. So when you
Yes.
inject it, it doesn't stay in one place. It just it kind of, what's the word I'm looking for? This,
Dissipates.
yes, dissipates. That's the one. Dissipates everywhere. Whereas this is more of a gel. So when you inject it in a certain area, it stays there. So it gives you a nice little kind of lift of collagen.
Oh my goodness. One of the commenters have asked about fat dissolving injections, which we kind of covered a little bit when we were talking about the lemon bottle, but are there safe fat dissolving injections?
Absolutely. There are a few available options in the UK, Aqualex being one of them, and Belkyra is a really other available one in the UK here. Is great. It's similar to Kybella in the US. It's the same one. It's just got a trademark thing, so they've got a different name. The way that it works, actually, it's basically liver salts. So our liver produces bile that essentially kind of digests fat. This is a synthetic version of that. So what it does, it just destroys the fat cell from inside, so you're able to just kind of excrete it and get rid of it. You're meant to not just inject the fat dissolver, you're actually meant to use a cannula, and that's the official recommendation. But unfortunately, that's more expensive to do, and it requires a lot more skill. And this is why a lot of kind of non-medical professionals, when they do this treatment, they just inject it in. It's similar. It's simpler. You just put it in a syringe and it injects it. But that's not the right way of doing it. And this is probably why when you had your fat dissolving
Mm.
treatment, it just didn't give that. I mean, you're looking fabulous, obviously.
I've been
It
sculpting it with a machine, so I've got it back, but it was terrible for a year. I looked like a puffy bullfrog.
Gosh, it took you a year.
It took me a year. I had to have old therapy. I actually own the machine, so I'm a bit of a geek. So I've got them in my house that I can do.
I love that. You're next level. Next level. Yeah.
I'm a diva extraordinaire.
You just sat there. People there with a gua sha and you with a full on
Oh no,
machine.
I've got
Like,
all the machine. I've got like an iron for the
um,
face downstairs.
that's like me with microneedling. One of my favorite things for the skin is medical grade microneedling. Not like the little roller, because that doesn't really do much. The proper
How
device. And I'm just sat
does
there
that
at
one
home.
work? Tell the audience how that one works.
Basically, microneedling is essentially calculated skin trauma. So what we're doing is we're using the device that has got teeny tiny little needles on it, so it's the thinness of a human hair, and they go in and out at 90-degree angles into the skin. So our body responds by producing more collagen, more elastin, and it repairs. So it's great for acne scarring, it's great for pigmentation, it's great for rosacea, it's great for aging, or generally just bad skin quality. It just gives you that wow factor. So I do loads of it just because there's no point injecting derma fillers and collagen stimulators and all these things deep if the surface of the skin isn't top
Mm.
notch.
So that kind of works inside the skin or down through the skin, but we can also do things like laser and chemical peels that kind of do it surface level. So how do
Yeah.
they work?
So basically, it really depends on what your skin concern is. So horses for courses, isn't it? With a peel, for example, some work on the top layer of skin, the epidermis, some is made down to mid dermis, and some are almost throughout the whole skin, and it gets rid of quite a big chunk of skin. And it depends on how severe the skin problems are. We use certain treatments for certain patients. But obviously, the deeper you go with the peel, for example, the more downtime you will have and the more complications can actually occur. So when you're thinking of a mid to deep peel, you should only go for medical professionals because this can actually cause a lot of problems.
Absolutely. So, if we were going to think about how someone that had been suffering from a lack of confidence was coming to you and they were thinking about just trying to change their whole life by getting procedures, would you say to that person, like, look, listen, we can just do what we can with these
Yeah.
needles and these fabulous things, but you need to do what you need to do first? Like, how would you deal with someone that came in with, say, body dysmorphia? Because I'm sure that's very tied into aesthetic medicine.
Actually, those are the cases where I very much keep my GP hat on and really discuss the BDD or body dysmorphia disorder because those are the kind of patients that will never be happy with any treatments that you do, regardless of how fabulous your results could be. They can actually cause a lot of issues in the long run. So I very much talk to them about the mental health side of stuff. And obviously, as a GP myself, I kind of discuss with them going to see their own GP, going seeking some medical treatments that could be therapy, medication, whatever it is, to really work on their psyche before getting any treatments done. And I actually had a young lady come back recently. I saw her 2 years ago, and she wanted to get a non-surgical rhinoplasty done, but she very much was seeing things that were actually not there, like some of the little dips that she was noticing. She was zooming in so far in that actually, with the naked eye, you will never see, the teeniest little something. And when we explored it, it came from a lot of trauma to psychological trauma from her nose. So actually, I told her, let's not get any treatments done. Go away, think about the treatment, think about getting some therapy. And she said she had 20 sessions of therapy. And she came in to see me just for a
Oh,
review. And she first thing she said to me was thank you. I was just not in the right headspace to get a treatment done. And she was like, I actually, regardless of how good the results would have been, I would have not been happy because the problem was not the nose. The problem was how she was perceiving her own nose.
that is so true. I remember, but many years ago now, I broke my nose when I was in school. This is probably about 20 years ago now, and luckily I became a model. But when you photographed all the time as like a very young teenager, they always tell you, oh, you've got this wrong with you, I can see this with you. And it starts to build in your mind that you've got something wrong with you. And so many doctors were willing to give me a nose job surgically. And I just think to myself, I would have looked like Michael Jackson. No shade if you want to look like that. But it would have been, there was nothing wrong with my nose to begin with. It was all just an over the top perfectionism that's built into you. And I think also in the trans community, which I'm a part of, there is that sort of gender dysphoria thing, which I guess you
Mhm.
encounter within the clinic too. Do
Absolutely.
you offer any kind of treatments that support people going through transition, whether it's masculizing the jawline for a
Mhm.
trans man or feminization? How would that work?
Absolutely. I say literally see a lot of patients throughout their transition journey, and it's very much, depend. The plan is kind of tailored to that specific person. Some want to look more male, some want to look more female, some want to look more in between, and that's a
Like me.
conversation for us to, yeah, you know what I mean, and which is, it's one of those things where it's very much that conversation to see what works. But I think because there's a lot of psychological aspects to it, and a lot of people, regardless of kind of, sorry, depending on where they are in their journey, they might not be there, they might not be ready for a big change. And that's why I think it's really important to do things step by step. Because if someone is still not ready to look more masculine, and you do all these treatments that makes them look more masculine, you actually might worsen their dysphoria at that moment. And I think it's why it's really important to kind of do things slow and steady, and it kind of goes alongside the transition journey, rather than just like one stop, 10 mils in, they look more X or Y or whatever.
Definitely. So, talking about aesthetical medicine, there are things that are changing within the beauty industry, I think, in the next year or so, including things like retinol.
Yeah.
So, retinol, the percentage is going to be you can't buy it straight over the counter anymore. So, certain products are no longer going to be able to be bought, and they have to be prescribed through a doctor. So, do you work on the skincare side as well? And it's amazing work.
Absolutely. Actually, every patient that comes in, they leave with two things: kind of a treatment plan, i.e., kind of what treatments we want to do, but also a skincare recommendation plan from me. Because I do think that they go hand in hand very, very well. And you will never be happy with just injectables without the right skincare treatments. So I prescribe things like tretinoin, which is basically the prescription version of retinol,
Mhm.
regularly for my patients, because this is the gold standard anti-aging treatment. And I find that, say, for patients that don't want a big change, hi Paloma, they don't want a big change, and they don't want kind of results that's like, oh my God, I don't recognize myself in the mirror. Just introducing good quality skincare gives them that confidence and the actual results that they want. So things like tretinoin, i.e., vitamin A, or a retinoid, vitamin C, a good quality SPF can really change the game.
Absolutely. So, there's so many things you offer. Do you offer everything in each clinic that's all the same
Yes.
procedures?
Absolutely. And actually, if people have any questions, anything they want to get done, just drop us a DM and my team will be able to kind of guide them through it. It's always good to meet with a medical professional and just have a chat, because I think that's really how things start, by just having that conversation.
Absolutely. There's one more question I have regarding aesthetical treatments,
Tell me.
and that's thread lifts, which we haven't covered. So threads are a fascinating thing that's got a lot of positives, but also there's been a harsh
Mhm.
amount of criticism. So can you
Absolutely.
explain what threads are and how they're used and the different types?
Yeah. So threads are essentially these little devices, these little tools that are inserted under the skin that grasp at the end that helps you lift basically a certain area. So that could be used to help with reducing kind of smile lines, reducing jowls or pre-jowls, helping with lifting the brows. It very much depends on where you use it. There are so many different ones, and unfortunately, they're available quite easily online. So a lot of people are offering them without really getting proper training. You can cause some real serious nasty complications with that one, because it's not like filler. We can just inject dissolver and
Mm.
get rid of them. If they're in there and they're causing a problem, you essentially need to cut them out. So I was
Oh.
speaking to a surgeon friend of mine, and unfortunately, a high majority of her work now is basically going in to fish out these threads out of people's skin. And here in the UK, it's by far the number one cause of complication in the non-surgical sphere.
Is it really?
Yeah, it's by
Oh.
far number. I think I was speaking to someone, and I think it's more than like number two, three, four, and five combined or something. Yeah.
Well, and I know there's some sort of threads that can actually dissolve
Yeah.
versus ones that stay there more permanently. Are they different things?
Yes, because it depends on what the thread is made from. Some are made from collagen, some are made from other kind of PLLA, which is a bit more of a collagen stimulator. It really depends. But even if they're dissolvable, if it's in the wrong place, it's still going to cause problems for 2 years. Do you
Oh,
see what I
wow.
mean? So
Yeah.
actually, I've seen some that are inserted really superficially. So for a patient that's got thin skin to start with, when they're talking and moving and so on, you can see the pull under the skin. It
Mm.
literally looks like a little puppet hand.
Which sounds like very macabre but fabulous in my mind. That's giving me inspiration
I
for
know
makeup
it
looks.
sounds fabulous, but it
Uh,
doesn't look good.
I'm thinking of Halloween looks actually. That'd be
Halloween's
quite
still early.
interesting. Well, amazing. Well, I've taken up more than half an hour of your time, and I know you're so busy, and it's been such a privilege to chat to you because you've got such a huge platform. Where can we find you and everything about you? And if people have any further questions, where can they ask them?
I am at The Aesthetics Doctor on all different social media platforms. My website is TheAestheticsDoctor.com. If you guys have any questions, send me a DM. I'll be able to help. But please, please, please always choose your medical professional carefully. There are a lot of cowboys and cowgirls out there that are doing things that they really shouldn't be doing. So very much do your research, ask questions, and feel empowered enough to actually, if you don't feel right at your heart, just don't get the treatment done.
Absolutely. We've got a couple of questions that have just come through,
Oh,
actually.
let's
I have
see.
some real deep forehead lines. What would you recommend
I think
for forehead lines?
if you just want to soften them, a bit of Botox could work wonders because they can just soften things up. But if they're really, really deep, then potentially the teeniest little bit of derma fillers could go a long way of just smoothing them out. But be very careful because actually, in certain derma fillers, in areas like here, could be quite dangerous. So make sure you go to the right place, get the right treatment using the right product and the right technique.
Fabulous. Are there any other questions before we wrap up? I think there might be. Well, we will definitely have to do something in person because I've
I
had
would
so much
love
fun.
that.
Yes.
Honestly, it would be
I'll
absolutely
pop
amazing.
up to Mayfair. I'll come up to
Come say
Mayfair. We can do
hi,
some
come for a
filming.
coffee.
Woo!
I'd love that.
Yay.
Thank you so much for having me. Honestly, it's been such a pleasure to chat to
Oh,
you.
you
Thank you so much for
too.
watching, guys. You've been
Thank
amazing.
you. And I'll repost this all over my social medias. Check out the incredible The Aesthetics Dr. Ahmed. And I will speak to you soon.
Thank you, guys.
Bye,
Bye.
everyone.
Bye.